Open enrollment for health insurance happens soon, and some South Georgians are worried about how much money will be coming out of their checks and pockets this year. WALB News 10's Ashanti Drake tells us how decisions made in Washington could hit home for thousands of families.
Insurance premiums for Georgians could skyrocket as the battle over subsidies continues in D.C. And now the decisions made on Capitol Hill are trickling down into South Georgia. For many families, paying for health insurance has become a monthly struggle. And according to the latest federal data, premiums in Georgia are expected to increase by double digits next year. And for some, that means choosing between coverage and other basic needs.
You're just talking about the day-to-day things that you need: food, water, shelter, paying your mortgage. I mean, that's $2,500 worth of subsidy that you would lose. That money is substantial. That impact is substantial to the everyday working class individual.
Sherry Barlow is not only an insurance director, but she's also a mother who says losing these subsidies could be devastating for families like hers.
Where would we go if we're not able to have these subsidies for ourselves, for our employees? It's going to be a very hard pill to swallow financially.
And she's not alone. Experts say that the rising costs are hitting low to middle income households the hardest, especially those living here in South Georgia, where access to health care is already limited.
Some 92,000 people in the 2nd Congressional District will have their health care premiums skyrocket. That means that providers, hospitals, particularly rural hospitals, will not have the support financially to keep their doors open. It means that people will not be able to get the health care they need. They will have to either borrow or forego purchasing food or other essential items to get health care, and ultimately it means that they will not have the care that they need, and it will result in death.
Places like the Samaritan Clinic, which serve uninsured or underinsured patients, say that they're already seeing the effects of higher premiums and limited affordable plans.
And without the subsidies, insurance becomes unaffordable. That's not what Affordable Care Act was intended for. It was intended to provide people with affordable health insurance.
With open enrollments beginning on November 1st, experts recommend comparing plans early and checking for updated subsidies or tax credits that might ease the cost burden. I'm Ashanti Drake for WALB, your hometown news source.